Hello again, and hope all are keeping well. This is the second lecture, belongs to the central nervous system depressants or CNS depressants. The first lecture yesterday was about benzodiazepines, as you know, and this lecture is based on another important class of neurological agents, which are the antipsychotics. As usual, in each lecture, we start with listing the objective outcomes. So I'll talk about psychotropic drugs, which also known as neuroleptics. Then we'll move to explain the most common neurological condition, which is schizophrenia. Then we'll give examples or details of the first generation of antipsychotics, phenothiazines, thiazanthines, and butyrophenones. And finally, we'll mention to the second generation of antipsychotics and talk about clozapine and olanzapine, which is the most prescribed drug in practice. So the psychotropic drugs are chemicals used to treat different mental health issues or different mood disorders, such as schizophrenia, mania, and anxiety, by affecting the behavior and emotions. Actually, the old explanation to schizophrenia is the excessive generation or increase the concentration of dopamine in neurotransmitter, and any drug inhibits the dopamine activity will improve the psychotic symptoms like delusions, al-awham, and hallucinations, and so on. In relation to the mechanism of action of antipsychotics, the general mechanism of action is the antagonism of dopaminergic receptors in the brain, mainly dopamine 2 or D2 receptors. The patient may experience side effects such as sedation, so it's recommended to take it at night. Also, antipsychotics can cause dropping in the blood pressure, cardiac effect, and sexual dysfunction. In addition, these drugs can cause Parkinsonism or extrapyramidal effects such as tremor or shakes and lack or slowness of movement, so it's not recommended to prescribe antipsychotic drugs for patients with Parkinson's disease because they can worsen the condition. So the antipsychotics or neuroleptics can cause severe side effects, as I mentioned. Therefore, these drugs should only be considered in severe mental cases to improve the symptoms and to stabilize patients' medical condition. There are two classes or generations of antipsychotics which antagonize the dopamine 2 receptors in the brain to give the action, as I said before. And the first and old generation, which called typical antipsychotics, includes phenothiazines, thiazanthines, and butyrophenones. And I'll give details about these three classes later. The second and new generation, which called atypical antipsychotics, includes the dibenzepine class, and examples of this class are clozapine and olanzapine. So the first class of the first and old generation of antipsychotics is phenothiazines. I'll focus on the SAR of this class, and if you look at the general structure of phenothiazine in front of you, you will see it consists of heterocyclic or a tricyclic compound related to the thiazine class, and you can see clearly the thiazine ring in the middle of the structure containing 4 carbon, 1 nitrogen, and 1 sulfur atom. Example of this class is a chlorpromazine antipsychotic drug. To explain the SAR of the general phenothiazine structure, actually there are 3 important points to be mentioned here. First, the carbon chain at the bottom of the structure between the 2 nitrogens must have 3 carbon atoms for activity. Second, R1 and R2 groups connected to the terminal nitrogen also at the bottom of the structure could be any alkyl, for example methyl, ethyl, or any other alkyl. Third, the presence of electron with a drawn group like halogens, chlorine for example, is essential for activity because it will pull the electron density from the pi system in the benzene ring and make it less reactive and more stable, as I've already explained before in the benzodiazepine lecture. As I mentioned before, the antipsychotic drugs antagonize the dopamine 2 receptors and decrease dopamine activity and improve psychotic symptoms. For the phenothiazines to give their action, the terminal nitrogen in the phenothiazine structure has to be protonated or accept proton H to form ammonium ion NH+, which can interact with the dipole formed by ClC bond due to the different electron negativity between chlorine and carbon, and this interaction can bend or pull the alkyl chain NH+, R1, R2 towards or in the direction of chlorine, which has minus charge, and this interaction will be for the favor of drug action. Just to let you know that the dopamine is a small molecule, and you are expected to be able to draw this structure if you have been asked in the exam to do so. The second class of antipsychotics is the thiazantines. An example of this class is the chloroprotoxin, which has similar structure to phenothiazine, except replacing the nitrogen atom in the middle ring of phenothiazine in the previous slide, replace it with carbon and double bond within the 3-carbon chain in the structure shown in this slide. Comparing to other classes, thiazantines are lack of hepatotoxicity and photosensitivity means better side effects profile. The SAR of thiazantines is simple and almost same as in the phenothiazine, and the structure should also have a 3-carbon chain between the middle ring or hetero ring and the terminal nitrogen connected to the R groups or alkyl groups. Also, the double bond within the 3-carbon chain must be in cis position to the electron withdrawing group X, which is also essential for activity, and both the double bond and the X group facing down in the same direction to give the best activity. The third and the last class of antipsychotics is butyrophenones. An example of this class is haloperidol, structure shown ahead, which is also a very common drug in practice. Butyrophenones have similar properties in terms of multiple actions as a tranquilizer or anxiolytic to treat anxiety, and also as antiemetic to treat nausea. However, butyrophenones are different from phenothiazines in lacking of hypothermia, which causes dangerously low body temperature, but they are more potent and effective in terms of causing extrapyramidal side effects or Parkinsonism, and therefore must be avoided in patients with Parkinson's disease. This slide is showing how to change or modify the structure to give different pharmacological action. For example, morphine and pethidine both have strong analgesic action. However, if we change the pethidine structure by elongation the N-alkyl chain, the new resulted product will give antipsychotic action. So look at the difference between the pethidine structure in the middle of the slide and the antipsychotic structure at the bottom of the slide. You will see that the pethidine has short N-alkyl chain NCH3, while the antipsychotic structure has long N-alkyl chain NCH2 by 3 CO-phenyl, so the analgesic activity no longer existing in the pethidine and replaced by antipsychotic activity. In relation to the SAR of butyrophenones, it is also similar to the previous two classes, and the structure must have a 3-carbon chain and electron with a drawing group X to show activity. However, the butyrophenone has ketone group connected to the phenyl ring, as you can see clearly in the structure ahead, and this ketone group could be replaced with another group connected to a phenyl and electron with a drawing group without affecting the activity. Finally, the terminal R group connected to the hetero ring could be any alkyl group like methyl, ethyl, or any alkyl group for antipsychotic activity. Now we'll move to the second and a new generation of antipsychotics and talk briefly about some examples like clozapine, olanzapine, and quetiapine shown in this slide. The structures of these agents have the benzapine ring or the 7-member ring in the middle, so they belong to dibenzapine class. Comparing to other antipsychotics, clozapine has less extrapyramidal side effects, so it is the drug of choice for patients with Parkinson's disease if considered essential by the psychiatrist. The suggested mechanism of action of these agents is improving the selectivity for dopamine 2 receptor and 5-HT2A receptor, which belong to serotonin receptors. Now, just to explain here in this slide and in the next two coming slides, the importance of the central ring in both antipsychotic and antidepressive structures and how this difference affects the activity. So, chlorpromazine on the left is antipsychotic drug, antagonizes the dopamine, while imipramine on the right is antidepressive drug, inhibits the noradrenaline uptake. The SAR can explain the mechanism of action of both drugs in terms of the central ring in both structures, as we'll see in the next coming slides. Now, just to refresh your memory with your previous inorganic chemistry notes, and as the geometry of the central ring in the chlorpromazine is sp3 hybridization, so the central ring is not planar and the alpha angle is about 140 degrees, so the tricyclic structure of chlorpromazine is active as antipsychotic. However, the geometry of the central ring in the imipramine is also sp3 hybridization, and the central ring is also not planar, but the beta angle is 120 degrees, so the tricyclic drug in this case, or the imipramine, is active as antidepressant. Finally, and at the end of this lecture, I hope you will be familiar with the antipsychotic drugs in terms of classification, mechanism of action, SIR, and other features in their structures. Many thanks for your attention and wishing you a very happy Eid al-Fitr. I hope everybody will enjoy it and will talk to you after the break. Thank you.